and welcome to Therapy Chat. I'm Dr. Dawn Parks, and with me is Christine DesLauriers, LICSW and addiction specialist. And today we're going to talk about addiction, what defines addiction, treatment, and the recovery process. So let's start with looking at, how we define addiction. And, the DSM, Diagnostic Statistical Manual, describes addiction as a compulsive and repeated use of increasing amount of drugs with the appearance of withdrawal symptoms when drug use ceases. Right. So we're looking at a few things. We're looking at one, tolerance. Right. So I may be using this much, but in a few weeks I need this much to get the same effect. And so I need to begin to increase my use of drugs or my use of alcohol to get those same effects. And secondly, withdrawal symptoms. So let's say I'm drinking a lot of alcohol and now I try to stop drinking, which we shouldn't do. It should be medically assisted. But when that happens, we start to see withdrawal symptoms such as shakiness, right? So some kind of a physical reaction to the absence of using the drug. Could be stomach issues, could also be psychological issues as well. What causes addiction? Still a lot of research being done in that field, but for sure, again, it's a few different things that we have to consider. We're looking at environment. If we are in an environment where other people use, or we're brought up in a home, a family situation where parents, other people living in the house are using, probably more likely. Psychological reasons, often, when you're talking to someone about when they first started using, things like, I was really anxious, or I was really stressed, or could be those kinds of reasons. When I had a few drinks, I was socially more comfortable, right? Or it could be, it was high risk and it was fun, getting away with something that we weren't supposed to do when we were 15 years old. So there's also a genetic component too. So if there are family members who have an addiction, not that the person will necessarily have an addiction, but they may be more likely to get into that situation, maybe easier than others who don't have that genetic component to it.
You can usually see that often genetic alcoholic versus one that develops it just over time. Yeah. Because what you'll see often is drinking at a much younger age. And immediately having an increase of tolerance, much more than their friends would have.
Yes.
And also symptoms like blackouts. And those things are coming on very quickly in starting out drinking. And that is usually a sign of genetic alcoholic.
To classify the drugs and alcohol, we can put them into different boxes if you want, right? Depressants, for example. And if we look at graphic 1, we can see that with depressants, important to note that depressants don't necessarily make a person depressed, right? But they do induce feelings of calm and relaxations, right? They can induce sleep, they can relieve anxiety, they can relieve muscle spasms, and can be helpful in prevention of seizures. Right? The problem with a lot of benzos are that taken in too much, in too big a quantity, we can fairly quickly develop dependence on those, and that increases likelihood of falling into coma, falling into non-responsive state, or even death.
There's also, I think it's important too with the depressants, that there's a cross addiction that you have to be aware of, because certain depressants, like the sleeping pills, the Valiums, the benzos, the Xanax, the anti-anxieties, they are in the same family as alcohol.
Yes.
Alcohol is a depressant drug, and when you have addiction to one in the family, you have addiction to all in the family. So if you are having a problem with say like sleeping pills or Xanax, and you start to drink, you probably are going to escalate in your drinking. Yeah. If you combine the two, you are doubling and tripling your risk to go into a coma and die, because you are double and triple depressing your system. So you have to be very careful. You can't mix those, and it's very easy to get addicted to more than one in that family.
Yeah, and sometimes, people don't even realize that it's not even intentional, but they're given something to relax themselves. They may be given perhaps Xanax or something like that, and then they'll think, oh, I'll have my glass of wine, and it may see in the tiny, tiny fine print, do not drink, but sometimes people don't read all of that. And like you said, it's doubling the effect. So it's kind of putting this suppression on those really life or death systems. We're talking about parts of the brain that regulate our breathing and our heartbeat. So we're kind of pushing down on that and suppressing it. So that's really an very important consideration. And also, just to point out that depressants really need to be medically supervised when someone has an addiction to them.
Yes. Right. Yes, you can die on some of the withdrawal from those depressants. So alcohol is also one you can die from. So you can seizure out. So you do need a medically supervised detox.
Yeah. That's all on that one. So again, some of the meds that are mentioned, right? These meds are meant to be taken per doctor's orders, but unfortunately they're abused, often abused. So that is so important to, if you're prescribed this, then that's what you take as prescribed. The second classification is stimulants. The stimulants give those feelings of energy, and they can help us stay alert, help us focus, help us increase our concentration.
Well, the dangers with the stimulants, if you're taking, for example, cocaine, and you go on a binge with it, you can induce a manic episode, because you are awake for sometimes days, and you will go into a manic psychotic type of state. And then also people sometimes when they crash from coming down from the cocaine will then try to take alcohol or depressants to ease the downswing, and that causes more problems. You know, in an extreme situation, everyone, John Belushi died from speedballing, which was taking heroin with cocaine to try to ease the downswing of cocaine. That same type of situation can be set up with cocaine and sleeping pills, cocaine and alcohol. It doesn't have to be heroin. You're giving your heart 2 sets of heartbeats, and you can induce a heart attack easily.
Yeah, and unfortunately, they're often abused in order to stay awake, give me that extra edge on being able to stay up all night and study. Sometimes abused for weight loss too.
Yes.
And you know, in large doses, they can cause severe anxiety. They can cause seizures,
Stroke.
paranoia, stroke, panic, stomach cramps, aggression, right? Some of the drugs that fall into this stimulant category are cocaine and crack cocaine, methamphetamine, but also ADHD meds, which unfortunately, you know, are frequently abused. Vyvanse, Dexedrine, Concerta. Caffeine is in that category, and nicotine too. So next one, hallucinogens. These induce hallucinations or perceptual distortions, and whether those hallucinations are visual or auditory or tactile, you might feel things that are crawling all over your skin. They come from plants, mushrooms, synthetic mixes, and some of the most common effects are visual hallucinations, rapid mood swings, severe ups and downs, and as we said earlier, auditory and tactile hallucinations. Things like LSD, PCP, psilocybin, peyote from cactus are the main sources for hallucinogens. Let's move on to drug schedules, right? So controlled substances are categorized on what we call a schedule, going from 1 to 5. So schedule 1 would be the drugs that have no known medicinal benefits, right? But they have a really, really high potential for abuse or addiction. So some of the things that we'll find, some of the drugs that we find in Schedule 1 are heroin, marijuana, LSD, ecstasy, bath salts, mushrooms. Those would be a Schedule 1. Schedule 2, some known medicinal benefits, but still highly high potential for abuse or addiction. These are things like painkillers, Vicodin, oxycodone, cocaine, methamphetamine, Adderall, opium. Schedule 3, still some medicinal benefits, but a moderate potential for abuse. Those are things like steroids, ketamine, and products with less than 90 milligrams of codeine, like some of the cough syrups, things like that. A Schedule 4, they have medicinal benefits and more limited potential for abuse. Things like Xanax, Ativan, Ambien. And a Schedule 5, significant medicinal benefits, not a lot of potential for abuse. Those are typically over-the-counter cough medicines. You know. But even though when we say low likelihood of abuse, you often see teens starting with
cough
medicine.
Right.
Yeah.
Yeah.
Yeah. So, so treatment. I mean, we know that the opioid use, painkiller abuse is a big thing, and still is a big thing. What's the treatment for that? There's methadone, there's Suboxone, naltrexone. So if a person who has an addiction to painkillers is in recovery, part of that recovery treatment could be the use of any of those things. It could be methadone, which is a daily, they would have to daily go to a place to get the methadone treatment. There's a Suboxone, which can be prescribed, and there's a certain dosage that they would have to take. And then there's naltrexone. The biggest thing is, and we talked about this in one of our sessions, is the recovery process from addiction is not easy anyway. It's really hard, and we unfortunately see a lot of relapses. So a person really has to be at the point where they're in a place where they really, it's more like a life or death thing, you know, where they really feel that they want to try to do what they can to get into recovery and stay in recovery. And sometimes that takes a few tries, you know?
Yeah, I think that the danger now, the heightened danger now, is that fentanyl has entered the picture, and it is not just in heroin anymore. It's in cocaine, it's in marijuana.
Yeah.
So even if you're a young kid and you're, you know, partying with friends and kind of experimenting and may not necessarily have an addiction problem at that moment in time, you could get something laced with that, and that could kill you, and
you don't know.
You just don't know. You just don't know. No. And I know we also had done a previous episode on, you know, mania and things, and I just want to, bipolar disorder, and I wanted to say that especially for young teens, marijuana use in certain individuals will trigger bipolar-like symptoms, psychotic symptoms, and that teenager will go to the hospital, or young adult, and get treated with antipsychotics and things that would be, you know, to treat someone who's having a full-blown schizophrenic or manic episode, and it's really a substance-induced disorder. And what you'll find is when that person stays away and detoxes enough, they will go back to a baseline level and be okay. The problem is they then go back out and smoke again, and they end up back in the hospital again. And you do that too many times, and you don't always recover from those episodes. And sometimes those manic or psychotic breaks become permanent, and that's a concern.
Absolutely. And you know, when we're talking about, you know, when does an alcohol or drug addiction become an addiction? Before it becomes what we call an addiction, as we defined earlier, you know, we may classify it as substance misuse, right? Light, moderate, heavy. But when we actually are using the term addiction, that means that we've actually are changing brain chemistry, right? We're interfering with either the production or the uptake of certain neurochemicals, and so we're kind of reprogramming the brain in a way. So when now someone is no longer using that drug, and this is important to understand, that when they're not using the drug, they expect to feel better straight away. But they have a whole physiology to change, and that physiological change, the physical change, can take a lot of time. So even though I'm not using, and I used to see this a lot in doing intensive outpatient programs and recovery, that people would say, I've not been using now for 3 weeks or 4 weeks, and I feel worse than I've ever felt, because now they don't have the drug to cover up those feelings, and so they could be talking about feeling bad psychologically, and not having their number one coping, which was, I don't know, it could have been any kind of drug, but also in the case of opiates especially, physically, I'm feeling my teeth that were rotten that I never felt because I was on opiates all the time, or a fracture I had and I didn't realize because I didn't feel it. Now I'm feeling all this thing. So feeling that is actually, although it's difficult, it is part of the steps towards recovery, and it's a good thing in a lot of ways, you know. But it's also understandable why it makes recovery so difficult too, you know.
And just coping with emotions, because you know, you have numbed yourself out, and you have checked out because you've been not wanting to experience emotions because they give you anxiety, and you don't have a lot of coping skills that you've developed, so you run away from it by escaping with drugs or alcohol. And so when the emotions are back and you don't have that to lean on, it gets scary, and it makes you want to pick up to get rid of that feeling, and not realize that if you stick with it, you'll get to the other side of it.
Right. And this is where the importance of a really good rehab, a sponsor, a therapist, family support can really be a critical factor in a person's recovery and building that support network. And for people who may be watching this who may you know, have a family member, and they're saying, you know, what do I do? Because I'm seeing this person kind of gradually destroy themselves. What is there anything I can do? Because they're an adult, you know. What are the possibilities? They don't want to go into rehab. Sometimes it happens that a person will say, you know, I realize what's going on, and I just want help. But often that's not the case. And so in Massachusetts, at least, there is something that's called an involuntary rehab, where a family member can actually petition the court to take out what's called a Section 35, where their family member, son, daughter, wife, husband, will be taken into rehab, will be required by law to go into rehab if they are in danger of seriously hurting themselves through the drugs that they're using or the alcohol, or hurting someone else. And then they can be, you know, they have a hearing and they will be taken into rehab. And rehab typically can only go up to 90 days, but it can be extended. The big question there is, how is that family member going to relate to me if I do that? There's a lot of fear. They'll never talk to me again. They'll hate me. So that's difficult. But what's often found out that is, you know, initially that person is really angry, but as they stay in treatment and they become more back to normal, if you want, they are actually, a lot of them show appreciation. A lot of them will say, that person saved my life because I will never have done this on my own. This is what had to happen, and I understand it, and I'm glad that it happened. So you do see that turnaround a lot of times, right? So,
and I would just say to people that really are not sure, you know, who meets the criteria for what in terms of addictions, don't get hung up on, you know, all of that. Basically, you know, it's not how much or how often you drink or drug, it's what happens to you that's the key. So focus on what happens. Are you getting into trouble? Are you getting arrested? Are you getting into problems at work? Are you having family problems? Are you, you know, tolerance increasing? Are you having withdrawal symptoms? Those are the key things. Those are things that social users are not experiencing. So if you're having any of those things, it's a red flag that you need to at least get some help, come in for an evaluation, talk to somebody.
And you know, and there are times when, you know, I'm talking to someone about a drug or alcohol, And I'll say, do you think you have an issue with it? And they'll say, no, it's totally under control. I have no issue. Then I said, but if you say, well, could you go for not using 2 days? Often it's no,
And then there are binge users who will go for weeks or months. So, what I tell people is try not to compare yourself to other people's use, because everyone's individual. Some people can't go more than a couple of days without using, and some can go a few months, and then they delude themselves into thinking they don't have a problem. But when they do use, it's out of control.
Yes, absolutely. So we have to stop.
Okay.
I did add to that graphic, there's a list of some resources for anyone who may be unsure of where to go, how to start the process, either for themselves or for someone they know. So there are a lot of rehabs, a lot of support services in the state. So if you go to any of these will be good starting points that can direct you into the area where you live and the help that's available where you're at. Thank you for joining us today. If you have any questions, if you have any further questions about the addictions that we've just talked about, or finding help, finding services, or understanding the process better, please check us out at phoenixinfo.online or call 508-623-3931 for more information. And thank you for joining us. If there's anything you'd like us to talk about specifically, you could also let us know. And we look forward to meeting with you for our next session. Thank you.